everybody. Welcome. My name is Brandy Alden, and I am here today with Darren Holman to talk to you about the power of acupuncture. Now, this is actually our second time filming this interview. The first time, the camera wasn't all that nice to us, and it decided to cut out midway through. But we had been able to talk about so many fascinating subjects, so I decided to post the video anyways. With that being said, if you enjoyed this interview of ours, I would suggest you go back on my channel and check out the other one that we did as well. Before we get started, I wanted to share a bit about Darren's incredible background again for anybody who hadn't heard it the first time. Darren Holman has been helping people with Chinese medicine over 17 years. He graduated from Virginia Tech with his bachelor's and Master of Science in Engineering. Soon after, Darren started an acupuncture school in Bethesda at the Maryland Institute of Traditional Chinese Medicine. He decided to continue his studies as he transferred to Texas College of Traditional Chinese Medicine and graduated valedictorian of his class with a Master's of Acupuncture and Oriental Medicine. Darren is the epitome of a lifelong learner, as to this day he continues to further his education and different acupuncture techniques and treatments to find innovative ways to help continue to treat his patients to the best of his abilities using natural remedies. I think it's safe to say that most people are familiar with acupuncture treatment, but they may not be familiar with how it works or why it works. Can you explain why acupuncture encourages healing in the body?
I will do my absolute best. So this is a topic that can be either really simplified down for some people, or it can be really scientifically complex. So we have a number of things that have been measured inside the human body, so we know these happen when you place an acupuncture needle, and then we have a number of other things that are theoretical, that are still yet to be proven, but seem to be logical theories on why it works. So one of the main theories that a lot of Western doctors think about acupuncture and how it works is a thing called gate theory. And gate theory is how they use acupuncture as anesthesia in like a surgical situation. We don't do much of that here in America, but they do that over in China. And so the principle there is you have a surgical procedure going on, say an appendix, because the reason I choose that one, when Richard Nixon went to China, the head of his press corps came down with appendicitis, but he had an allergy to all the anesthesia meds. So he got his appendix removed under acupuncture anesthesia, and that's actually what brought the information of acupuncture to the U.S. for the first time.
I didn't know acupuncture could be used as anesthesia. That's so interesting.
It's one of these things where you have a signal coming from the area that they're working on, and it comes up to the brain. And if you have another signal that can intercept that kind of highway and take the place of that signal, now you've interfered with that signal. So you can kind of numb out the area they're working on by sending an interference signal to the brain. And they call this gate theory, because you're kind of like opening one gate to block the other road.
Okay.
And so a lot of people think this is how acupuncture treats pain. But unfortunately, if that was the case, that would only work as long as you were stimulating the needle. And if you're not doing that, the pain would come right back. So you would get temporary pain relief, but it wouldn't give you long-term healing. So as far as other theories of how it works, if you think about people who heal the most quickly, little children heal faster than anybody. And little children have circulation that's second to none. So if a kid falls down, and usually they don't even bruise, but if they do bruise, they can get rid of a bruise in a day or two. Whereas if somebody my age bruises, it may take a couple weeks to get rid of a bruise. And so my circulation is not as perfect as that of a young child. And so when you place an acupuncture needle, you actually cause the body to release chemistry into the bloodstream that causes blood vessel dilation, and you get more circulation to that area.
Okay.
And so not only does it work on the area you work on, but the body is set up in a holographic balance, which that's a super technical word, so I'm going to bring that down a level. So what that means is if you work on one area, it'll trigger remote changes in another area. And so, for instance, if you had knee pain and I come to your opposite elbow, I can press on that elbow. And where the pain is in the knee will have points that connect to it on the elbow. And if I press there and it's tender there, I can place the needle here, and then now you can feel the pain relief in the knee. Now what goes on there is changes in flows of electricity, changes in blood flow, and changes in nerve signal. So we're changing the way the body checks in with the tissue, and if there's damage there and I place a small needle, that needle causes the skin to release this chemistry that causes more blood to flow in the body.
Okay.
There's also a thing called the delta reflex, and the delta reflex works through the brain to hit another area. So if you trigger an area that connects to another area, you will actually see the skin in that other area change temperature.
Interesting.
In the studies, they said it could change up to 5 degrees.
Mm.
I have never observed a 5-degree change personally. I would be impressed to see that. But you can see a change sometimes of a degree or two.
Okay.
And on a thermal camera, you can actually watch the area change. So you're triggering healing in that area. So a teeny tiny hole from a needle tells the body, hey, repair activities need to begin to fix that teeny tiny hole. But while it repairs that area, it also kicks in repair on the other area. So a similarity that I would say would be in Western medicine, there's a technique called prolotherapy. And prolotherapy is useful when you have an injury that has stopped healing, but you still have some pain and restriction and things in the area. So I have a dear friend who is a doctor up in Washington, D.C., Dr. David Wang, and he specializes in these kind of regenerative medicine. So he was kind enough to help me out with a wrist injury that I had.
Okay.
I fell off a skateboard, my wrist was hurting. Years later, still wasn't fully healed. So he explained to me how it worked, and he did a procedure on me. And so they use a mixture of dextrose sugar and lidocaine. So lidocaine numbs it, so it's not uncomfortable that you're kicking off all this inflammation, and sugar causes inflammation. So he took the syringe and he put it in the different areas of my wrist that were injured, and he squirted the sugar solution in there, and it triggered all this inflammation. The inflammation now tells my brain, oh, Darren's hurt his wrist again, and then it re-kicks in the healing, and then the wrist heals. Now it doesn't work quite the way I expected, but it was amazing. So he does this, and like the next day I'm like, my wrist feels the same. A week later, I didn't feel much change. 2 weeks later, I didn't feel much change. 3 weeks later, it was like I had a brand new wrist.
Wow.
Like no pain or stiffness left from the injury that, like I said, I had had for a few years. So in theory, when you place the acupuncture needle and set a little bit of trauma, which I say trauma in a very loose definition, you don't feel a properly inserted acupuncture needle, then it kicks off healing in that area, but it also kicks off healing in the other area. Now, there's a number of other mechanisms that go in. There was a gentleman named Dr. Lowe, who's a 3-time PhD, who wrote a book called The Biophysics of Acupuncture.
Interesting.
And in his book, and I'm going to try to take his very complex subject and make it approachable, he talks about how the lines that are the acupuncture meridians work based on his experience and theory. And he says that if you look at the body, these lines of acupuncture meridians, what they physiologically are, if you did a dissection or actually looked at the structure of the body, is they're folds in the fascia between the connective tissue and the muscles. And your entire body is nothing but different tissues that are wrapped in fascia. And so if you took all the rest of your tissue but your fascia away, you would have a mostly clear version of yourself that you could fill up with water, kind of like Ziploc bags. And so in between these planes, there's this water running.
Okay.
And in this water's the kind of magical substance of life, and it's made out of these molecules that are called polarized molecules. So one end of the molecule is positively charged, and the other end of the molecule is negatively charged. If you have a nice electrical current running through that flow, then these molecules link up and form chains. And according to his research and his theory, like I said, not 100% proven yet, not fully accepted yet, but very logical and makes a lot of sense, that if you have a body that's out of regulation, it cannot communicate inside itself to make the tissues work the way they're supposed to. Often it's because you have a change in this electrical current, so these linked chains of molecules break apart, communication within the body breaks down, and it can't regulate itself. when you place an acupuncture needle, and this was all researched in France, the work that started out with a gentleman named Niboyer that I might get into at another part of the interview, and then the researchers that came after him, basically when they proved that your body is a series of electrical circuits, when you place 2 needles on an acupuncture meridian, you induce a current that once again relinks up these chain molecules, and now your body can talk within itself again.
Okay, so to kind of summarize, acupuncture needles can help send those electrical signals to your brain, basically to allow circulation, and then also to encourage that communication in your body.
Exactly.
Okay.
Helps encourage the homeostasis and the regulation of the inside of the body. And there's many more reasons why it works, but I don't want to drag your interview out for about 3 hours, so we'll touch on that for now.
No, that's perfect. That's so interesting. And I find it interesting because we talked about this question last time, and you had a totally different answer because you talked about all different kinds of...
the research by Niboyer and how they came up with these more advanced theories. Today I stepped into the more advanced theory, but the other one was more the foundational work that led to it.
Yeah, so if you want to check out that, go back to the other video. Okay. What are some of the common misconceptions you often hear about acupuncture? I know one of the ones I get a lot when I tell people that I get acupuncture treatment on a weekly basis is, does it hurt? To which I say, no, I barely feel it at all. I think there's only been a couple times where I'll say, oh, okay, I felt that. Even then, it's like a pinch. And so oftentimes, I can't even tell when somebody's putting a needle on me. But what other misconceptions do you hear as an acupuncturist?
The common misconceptions are definitely that one. I meet people all the time, see that they have a problem that's bothering them, offer to help them, and they're like, oh no, I hate needles. And I'm like, I think this is rooted in our conception of what a therapeutic needle is. So when we think of, we're all, most of us are growing up in America, and the primary system of medicine is our very established Western medical system, which is amazing. But we don't use the same tools. So if you go to the doctor and have a needle, that's a syringe. So it's hollow. It has to inject something in or suck something out. So by the fact that it has to have a hollow tube in the middle makes it orders of magnitude larger than what I use, and means that anything that has an edge, like the edge of a tube, is a blade. So when you get a syringe, it cuts you. That's why you have to have a Band-Aid on afterward. An acupuncture needle is a solid fiber, and the ones I use primarily the second smallest size made, smaller than some people's hair fibers.
That's what I've heard before. That's crazy.
And so I can fit 30 of mine in the bore of the doctor's small injection needle. And so the gauges, for people who know needle gauges, I use some that are even as small as like 48 gauge. And so if you know about needle gauges, that's really, really tiny. And so people fear that it's going to hurt. What I tell them is a properly inserted acupuncture needle should not be uncomfortable. Feelings you can feel are pressure, a flowing sensation, a tingly sensation. Often when it's kicking in and starting to work, you can feel either a pulsation on the needle or a pulsation in the area it's affecting. Sometimes if you stretch tissue near a nerve, you'll feel a little bit of a ting, like a zingy kind of feeling. It's not painful, but it's strange feeling, so I warn people about it. If one of the rare points that does that, so just in case they're going to feel that, I tell them in advance. And then I tell them it should never hurt. If you're feeling something that is bothering you, tell me. It means that the needle is stretching tissue, not cleanly through tissue, and I can change the way it's inserted and fix it. So there's never a time to sit there and grin and bear it and feel something that's uncomfortable.
It should be relaxing.
It should be totally relaxing. Back to the earlier question, sorry, but when you're asking about how it works, often when you get acupuncture, the brain, the central nervous system, has 2 functional units. One is the sympathetic nervous system, which is the one you guys have all heard about fight or flight. And the other one is the parasympathetic nervous system, which I call, or a lot of people call, the rest and digest. So fight or flight prepares you to either fight to defend yourself or run away. So all the blood comes from your organs out to your skeletal muscles, your senses are all keyed up, and you're more excited, not relaxing. Rest and digest allows your blood to come back to your organs, and then your nervous system calms down knowing you're safe. Putting in acupuncture needles puts you into a parasympathetic state and relaxes you and makes it feel very comfortable and warm and, a nice feeling. So if ever you're getting acupuncture and it's not that, there's a couple things you can do. One, affect your breathing. People hold their breath because they're anxious, and that keeps them keyed up, locks down their diaphragm, and then they feel nervous. Two, you can actually have the practitioner guide you through breathing as they're placing the needles, and you'll feel it even less. So say somebody is really needle sensitive to the point where they even feel something tiny. If the practitioner has them inhale prior to placing the needle and then exhale as they place the needle, they won't feel them at all.
Oh, wow.
So you can use this for patients that are, really, really sensitive. So the other ones are, people think that acupuncture fixes pain by somehow damaging the nervous system and like taking a nerve offline so that it's not sending signal. I can assure you this is not true. The vast majority of your nerves are multifunctional. So not only do they send pain signals, but they also send drive signals to muscles or monitor other things in the body. And so if we were damaging your nerves, we would be causing, long-term damage to your body that would affect you in other ways. And this is obviously not what we're trying to do. So
it sounds to me almost like it's the complete opposite. You're not breaking these connections in your body, the communication that's happening. You're encouraging it. So.
Exactly. What you may break, though, is sometimes redundant signal. So say you had an injury, that injury healed, but your brain still keeps thinking, my elbow hurts, my elbow hurts, my elbow hurts. Mm-hmm. You can place acupuncture needles, make the pain go away, and then the brain kind of re-indexes that connection, and it'll be like, oh man, my arm feels great, I'm functioning really well. But then, like say you had elbow pain for years, like a week later you might be like, I'm starting to feel that again. It's the brain wanting to remember that signal, and it starts kind of self-creating this signal. And so if you do acupuncture again, and you're like, man, I really feel great when I don't have that signal. And over a course of a treatment to a couple treatments, your brain can adaptively learn to stop filling in that signal, because sometimes chronic pain doesn't show there's still a problem. It's just a nerve signal that needs to be taken care of.
That's interesting. I've never heard that before. That's so cool. Okay. So why did you choose to study acupuncture over different forms of medical care?
I had actually considered going into Western medicine when I was younger. I did my first 2 degrees in engineering, and I like science. I like figuring out why things work. I like researching, and I really like helping people. That being said, by the time I finished my first master's, I was pretty burned out on education, and so I went out into the world and I worked as a computer programmer and a business consultant for a while. Well, at the time, I had studied Kung Fu for 6 years throughout college, and we had a really excellent opportunity in our Kung Fu school where we had a healing program. And in this healing program, we would actually bring in doctors from a medical school over in West Virginia, Lewisburg School of Osteopathic Medicine, would come and teach courses and at our Kung Fu school, and we would pay to learn things like craniosacral therapy or strain counter strain or myofascial release, things you don't really need, a license to know how to do. Now, if you want to charge money, you do need a license. But I learned that I was really good at these things, and I really enjoyed helping people. And so when I went to work in corporate America, I'd be sitting in a cubicle, computer programming away, on my own, face to face with the computer, and I would hear people talking about their problems from other cubes.
Yeah.
And I would get up and go fix their problems, which isn't great for your performance reviews, just let me tell you that part. But it's really good for, feeling that need to help people. Well, at the time, my next Kung Fu teacher was an acupuncturist, and I'd never experienced it before, and then I went and got treatment from him, and it was highly effective, painless, and I was like, I could take all these skills I've already learned, add them to a new whole system, and then I would have a license under the U.S. Health Code, so I could do it as a business to help people, and I wouldn't get in trouble for practicing without a license. And then the other thing that really made me fall in love with Chinese medicine was the Kung Fu family that we were a part of had part of its instructor training was learning the medicine. They were a big believer that if you should be able to tear somebody apart, you should be able to put them back together. And so we had learned probably about the equivalent of at least the first semester of acupuncture school, maybe first 3/4 of a year, through taking the training. But what really was amazing was we have amazing Western medicine in this country. And if you have the things Western medicine is amazing at treating, who to go to. If you have a severe infection that could be life-threatening, if you have trauma that needs to be surgically altered, if you have, a lot of different things, they're amazing at treating that. But since Chinese medicine comes from a definition of preserving health, not just heading off illness, there's so many tools that we have in Chinese medicine that can treat conditions that Western medicine doesn't excel at. So, for instance, if a woman comes to you and she's having a problem with her menstrual cycle, and I'm not in any way bad-mouthing Western medicine, but more often than not, that person's going to be told, we can regulate your cycle by putting you on measured doses of external hormone to tell your body what to do. But then you're on that prescription, and you have to be on that prescription to get that result.
Right.
Whereas in Chinese medicine, we have a model of how all the different systems interrelate to each other. A lot more like what Western medicine's calling functional medicine now, where you really focus on how one system regulates another system. And when you come to find when one system has an imbalance, and then you can fix that imbalance, and now the other related system is in perfect harmony, you can actually fix, regulate the menstrual cycle, help with infertility, help with migraines. One of the things I have great results with is like autoimmune conditions like IBS and Crohn's disease and things like this. Really hard to go in and just give a drug and fix that because it's a complex pattern in the body. But if you can fix the pattern in the body, then the person can get great relief. And so seeing that our country pretty much has an amazing Western medicine establishment, and at the time, yes, there were a good number of acupuncturists already practicing before I came along, but it's really grown since then even more. And so we have a lot of great doctors, but we needed more great acupuncturists. So I figured I could fill a role in the medical system that was maybe underrepresented.
Yeah, that makes a lot of sense. I love that you brought up the point how acupuncture can be so beneficial for people with autoimmune conditions, because I know from my experience dealing with autoimmune conditions, a lot of times I've gone to doctors and they told me the only options for you are, you can try some of these medications that are shown to help some people, but oftentimes those medications didn't work for me. But then otherwise they didn't really give me a direction on how to change this. And then when I found things like functional medicine and acupuncture specifically, I was able to help try to fix the problem on a deeper level by instead of trying to manage the symptoms by using a medication, we were able to almost try to fix the patterns that are causing the symptoms. And so I think it's helped me to find even deeper healing for myself as somebody with autoimmune conditions. And so I've really come to appreciate acupuncture in that way for how it can communicate with the body in a way that medications right now, as far as I've seen in that community, have not been able to do quite yet.
And, I'm one of these people who is a fan of any kind of medicine that gets people better. And there are medications out there, like certain things in Western medicine, like antibiotics and things like this. If you have a severe infection, miracle drugs, and some of these drugs are coming out, work amazing for some people. Like I had a really wonderful lady who came to me for rheumatoid arthritis for the longest time, and we probably worked on her for maybe almost 2 years. And as long as she came in and got regular treatment, her life was night and day better. Her pain was less. She could pretty much do all the activities she wanted. But if she stopped coming for a while, it wouldn't respond as well and her symptoms would come back. Now, I've learned a lot since then, so if I had her again, I think I could do a better job than I did before. But she actually got put on a medication. It was a new trial medication for rheumatoid arthritis, and it literally changed her life. And one of the interesting things about her story is she was going away on a big trip to Egypt. And when she went to Egypt, she got really, really sick. Like she got a flu or something. She got really sick while she was in Egypt. So she came back and she was coming in for her acupuncture again. And she told me about, this experience of getting sick in Egypt. And while we were talking about it, she's like, yeah, it's kind of like the way I feel sick every time I get acupuncture. And I was like, wait a second. You shouldn't feel sick when you get acupuncture. Like, what's going on? And so we started to look at more subtle things. Like, what else do you do on the same day when you get acupuncture? Because acupuncture shouldn't have a side effect of making you feel sick. And it turned out she was getting her allergy shots the same day she would get acupuncture.
Oh.
Well, you have an autoimmune condition. An allergy shot is meant to harmonize with and kind of make your immune system active towards some things and calm it down towards other things. So you're interfacing with your system. And so for 2 years she had thought that acupuncture was what was making her feel bad that day. She's like, oh, I feel great the next day, but that day I feel, not that good. And then we figured it out, and she spaced her allergy shots out to a different day. And she's like, oh yeah, it's definitely the allergy shots that are making me feel that way, not the acupuncture. So it should be a harmonizing influence on your body. That's one of the things I really like. You don't frequently see side effects from acupuncture. The side effects that you can get from acupuncture are things that have to do with literally the process of putting a tiny needle. There's a chance you could hit a tiny capillary, you could get a bruise. In really rare cases, if you treat somebody standing up instead of laying down, you can have what's called a vasovagal effect, where you affect their body and make it relax so much that their blood vessels dilate and their blood pressure drops, and then they feel like they're going to pass out. Now, the way you don't get that is you always treat them laying down. If you always treat them laying down, you don't really get that. So there's these little side effects like this that are just physical effects of what you're doing, but you can kind of cope with them and not have them happen. But you shouldn't ever feel sick after you get acupuncture. Herbs and some things, everybody has different allergies and different sensitivities. There's a chance you could take an herbal formula and maybe get a little stomach upset. That's why I always start any new herbal formula with a small dose first, just to make sure that your body tolerates it before you take it. But yeah, acupuncture shouldn't have side effects.
Interesting, yeah. I think that's a great way to put it too, is that, for those like myself, if medication doesn't work for you and you have an autoimmune condition, I know for me, I would highly suggest you try out acupuncture, because it can have some really potent effects and benefits for those going through those types of things. Okay. We talked about this a little bit, but I think acupuncture is most commonly associated with treating chronic pain. I would like you to go a little bit further into some of the other common conditions and symptoms that you treat, outside of the ones that we've mentioned. I know we mentioned, problems with menstrual cycles, fertility problems, autoimmune conditions, pain. What else do you typically see?
Acupuncture is great for allergies. There's a number of different systems, just traditional acupuncture to harmonize the body and make the immune system work at the right level. If you think of an allergy is not that your body is having a toxic reaction to a substance. It's not poisoning you. It's just triggering your immune system to be hyperactive. So if you can calm that down, you can lessen allergies. But then there are other people out there, a Western medicine doctor up in Rockville, Maryland, named Dr. Nader Solomon, who came out with a system called SAAT, Solomon's Auricular Allergy Technique. Auricular implies to the fact that it uses the ear. And in that technique, literally, he found that your liver is the part of the body that holds the memory of what you're allergic to.
Interesting.
And so what he found was that if you had somebody who had a liver transplant, and if they get this liver transplant and then their body regrows the sample liver, the donor gave a piece of their liver, that liver grows to fill in. And so the donor's liver grows back, so they're fine. And then the person who got the donation, it grows to fill in. And so there's now 2 complete livers because the liver's good at regenerating. Well, often the receiver of the transplant will develop all the allergies of the first person, of the donor. And so he came to his medical colleagues and he said, hey, is this true? Is this what you think is happening? And some of them said, yeah, that's plausible. And others said, we think it might be the steroids and anti-rejection medications that's triggering the allergies. And so he went back to, think about it. And he's like, well, we use steroids and anti-rejection medications in heart and kidney transplants, and we never see that. So he went forward and he came up with this very impressive system on how to test to see if a person is allergic to a substance, and if so, how to use needles on the ear, and they're actually leave-on needles, so you actually wear them for a little bit of time. The longest is 3 weeks, but they're teeny. I have to use tweezers to even handle them to put them on. They shouldn't be painful at all, and they go underneath a little sticker on the ear so people can't even see them, so they're blended in. And when you take them off, the person's not allergic to that substance anymore. And I've seen success with that for cats and household chemicals and seasonal allergies. And the most impressive one is it's actually, I've been successful at removing 2 anaphylactic peanut allergies in children.
Wow.
So something that was before life-threatening, and now if they get exposed, either they'll have no reaction at all or a much mitigated reaction.
Wow, that's
So
incredible.
sometimes after the procedure you still have antibodies in your bloodstream, so you may still react one time, but after that your reaction should be either completely mitigated or taken away.
That's incredible. I just actually started that myself. I have one in my ear. Nobody's even noticed it. I haven't even noticed it. And I am so excited to see the effects, because after we've been talking about this, I mean, it's just the incredible story that you've told me about how acupuncture can help with allergies. I'm like telling everybody now, I'm like, you gotta try this out. This is so cool. All right. For someone who wants to see if acupuncture works for their concerns, how would you suggest that they get started? How should they go about finding an acupuncturist that would be a good fit for them?
I think, in my opinion, acupuncture is a very interpersonal type of medicine.
Mm-hmm.
You'll do a whole lot more talking than you will in your average medical appointment. So we usually schedule anywhere from an hour to an hour and a half for the session, and we really get to know you, since we're basing all of our medical decisions on a pattern of your whole overall health. We'll have to talk about a lot of different things. How's your emotions been? How's your sleep been? How's your digestion been? Have you been having any sweating or cold symptoms or things like this? And it can take time. So you're going to want to find somebody that you can communicate well with. The other thing I think, but I have a little bit of a bias because, like I said, I'm an engineer, so I like explaining things. So I usually recommend someone who can explain to you. But like I said, that's my bias. That doesn't mean the person can't treat. It just means if you're more comfortable with knowing why something works, when you call them to ask about your appointment, ask, hey, have you had experience with this? Or, can you tell me how acupuncture would treat this? And when they feel comfortable in telling you how it works, they know what they're talking about. Mm-hmm. There are a couple indicators. There's many practitioners in the world now that are doing therapies with acupuncture needles. So we have doctors who get acupuncture certified. That includes chiropractors and other people like that. We have licensed acupuncturists, which is the category I'm in. And then we have like physical therapists that are doing a thing called dry needling. Dry needling is a different practice than acupuncture a little bit, in the fact that acupuncture has local point needling.
Okay.
And so you can affect the tissues directly with local point needling.
Okay.
Dry needling is an entire system that's based on affecting local tissue by stimulating with needles. But they don't use the meridian system, so they're not going to do affecting other areas of the body or things like this.
Like we talked about before, where you can put a needle
Exactly.
in one place and
Have an effect
Okay.
somewhere else. So theirs is more of a local system. Everybody has their biases. I'm not going to get into the political rigmarole of the conflict between acupuncturists and dry needling. Try it out for yourself either way, but just know they don't work in the same way.
So try to find which one is the best fit for you.
Right. So the thing that lets you know that you're with a practitioner who has undergone the largest amount of training, and that's the LAC at the end of their name, licensed acupuncturist. So in the state of North Carolina, that is our professional designation, is licensed acupuncturist. So you can go to some schools that have a master's degree program. That's what I did, Masters of Acupuncture and Oriental Medicine. But my title in North Carolina is LAC. Now some schools have doctorate programs. So you went and did a little more. More often than not, it's research-based, but in some cases, it's extended clinical-based, things. But the reality is, if you're a practicing acupuncturist for a number of years, you have to do continuing education every year.
Okay.
So say you went back to school and you got your doctorate, you're going to learn things you didn't know before. But if you just are in practice and treating patients every day and going to seminars and continuing your education, you're going to learn similar things. So I don't think that a difference between a master's and a doctorate is as big a difference as the letters, make people think. But that could be a biased opinion because I have a master's, not a doctorate. So, but if you get that LAC, it means you went through a accredited acupuncture school with a training program that's between 3,000 and 4,000 hours of training, and that you sat for your national board exams, and there are 5 national board exams, and if you pass all 5 of those, you can get nationally accredited. So now, in pretty much all the states now, you have to have both of those to get that LAC. Now, if you're getting a certification in acupuncture as a medical doctor or a chiropractor, they're counting on the fact you already went to med school for part of your education, so the amount of classes you go through is stripped down to give them quicker access. And my probably unpopular opinion is, even though they have less training in acupuncture, everything that I learned in school can be learned through seminars or books as well. So I'm not one of the people who thinks just because somebody doesn't have an LAC, they can't be a good acupuncturist. It just means they have to work harder to get to be a good acupuncturist. If you're looking blindly with people you don't know, the LAC is a good indicator of how to find a trained professional, but some of the other people could be amazing practitioners too, so I don't want to count anybody out.
No, I think that's a great way to start too, especially for people who are unfamiliar, to have something to look for. So looking for that experience and then trying to find somebody who has that personality that's a good fit for you.
Exactly.
I know, like for me, I like knowing the fundamentals around what we're doing, why is it working. And so it's been helpful having somebody like yourself who is able to translate that for me. And but I know other people where that's not as important to them. They just want to go in, they want to feel better, and as long as they get those effects, they don't need any of that extra explanation. But for me, that's an important aspect for me. So finding that good fit and certainly looking for that training, I think that's a great way to start. I've been coming to you for a couple years now, and I feel like I've learned not just about acupuncture, but about so many other different forms of treatment that have shocked me. Things like using moxa sticks, acupressure therapy, and light therapy. Can you go into depth about some of those other practices and how they might be beneficial for similar conditions or chronic conditions?
Sure. The thing I love about adjunct therapies added into acupuncture is it's something that you can actually teach to the patient. Most of them don't require any kind of licensing. You're not penetrating the body, causing any kind of harm. They're fully safe, and frequently the results are pretty good. I have a nickname for myself. I call myself the world's most open-minded skeptic. And the reason I do that is because I am willing to audit any kind of healing modality, but because I'm an engineer, I'm then going to design experiments to see if it works. And anytime I learn something new, I do it for free on about 30 people so I can get some data on, is that working or is that not working? And if I find that it works 90% of the time or more, it tends to go into my bag of tricks. If it's working kind of hit or miss, I'm not going to put my integrity on the line to mix this into what I do. And so the things I find that I use a lot are, like you said, the moxa sticks. I probably don't use those as much as I should. I should probably work that more into what I use because those can be so effective. Acupressure, giving people points they can press based on a number of different systems. Acupressure and acupuncture have a lot of different underlying reasons they work, so you can base it on different systems. There's localized points, points to relieve headaches and things like that. But truthfully, I like the distal points better. It's a personal bias. So you always hear, oh, if you have a headache, squeeze this point. Well, if you squeeze that point, yes, you'll feel the headache let go. But frequently, when you let go, the headache comes back. And then you're like, that didn't work, and you dismiss that. But there's little things you can do to augment that and actually make it work much more effectively.
So, like what?
One of which would be a red laser pointer. And the cheaper the laser pointer, almost the better. The only thing that's bad about the cheap ones is they use those little like watch battery looking or hearing aid battery size batteries, and your batteries die and it's a pain to go buy them. You can usually buy them at the dollar store pretty cheap, but the little bit more expensive ones that actually run on like AAA batteries, battery lasts a lot longer and it's not as frustrating to have to keep changing the batteries. But the reason a laser pointer works on an acupuncture point is because of some of the principles in light medicine. So there are these cells in your skin called chromopores. And different chromopores respond to different frequencies of light. But almost all of them respond to the red wavelength 635 nanometers. And 635 nanometers is the cheapest laser diode there is. So the same little toy that can make your cat run around can treat arthritis, can fix headaches. I have a fun story that there used to be an amazing herbal shop down in Indian Trail, North Carolina here, that some wonderful ladies that I was friends with ran, called Clara's Choice for Herbs. And you could go there, and they had great knowledge on herbs and other alternative therapies. And I was in there shopping one day, and there was a lady who was there with migraines. And she was a friend of theirs, so she knew them, but she didn't know me. And they were great referrals to my clinic. You know, they referred me a lot of people, so they had faith in me. And she's like, well, have you ever tried acupuncture? And she's like, you know, I don't believe in that. And she didn't realize the guy standing like 4 feet away was an acupuncturist. So I let her finish her conversation, and then before she checked out, I walked up to her and I said, you know, I'd really like to help you with your headache, if that's something you'd be open to. And she looks at me like I'm crazy because I'm a random stranger approaching her in a store. And she said, if you can do anything my doctors haven't been able to do in 6 years, I'll be impressed. And I'm like, well, I'm not charging anything. It's totally safe, and I'm willing to try. So her headache was behind her eye, which is frequent for migraines. And the meridians that run behind the eye are the stomach channel and the gallbladder channel. Usually I find with most people, if it's a woman and it's connected to her menstrual cycle or other things there, probably more likely gallbladder channel. And so using some of the systems in balance method and some of the other acupuncture systems I use, a good point for treating gallbladder are points on the heart meridian. And so in the holographic model of acupuncture, you can image your torso onto your limb. So your hand becomes the head, your wrist is your neck, your belly button is your elbow line, and then the bottom of your armpit's the bottom of your torso. Well, that can also be flipped upside down. So your shoulder's your head, the group, you know, underneath your deltoid muscle is your neck, belly button, and then the hand's the bottom of your torso. Seems kind of conflicting that it can be both, but I assure you it works both ways. Now, if you look at how your brain connects to your rest of your body, there's a lot more nerves in your hands than there are in your shoulders. So if you put a needle in the hand, you're going to get a lot stronger signal to the brain than you are if you put one in the shoulder. Shoulder points still work great for headaches, but I find hand points are amazing. So if you're using the heart meridian, which runs down the inside of your little finger, right here where that line on the palm crosses the hand, on the inside of the bone that connects to your small finger, if you have a migraine behind your eye, go to the opposite hand and press right there. So if I had a headache here and I pressed here, this would be amazingly painful to press on. Now, if I don't have the headache and I press the same point, no pain whatsoever. But if I press right there and it's painful, that tells me they're connected. So I came to her hand and I pressed on that point. She winced. It was painful for her, and I was pressing very lightly to be kind. But I pulled a laser pointer out of my pocket and I pressed it into that point, and I turned the laser on, and I sat there talking with her, and I kind of watching my watch, and I timed it for about 3 minutes. And at the end of 3 minutes, her migraine was completely gone.
That's incredible.
And so you can use these techniques for a lot of things. There's one that used the same rules that I was taught. I'd never seen this actual point pointed out for this, but the rules spell it out pretty straightforward. So same kind of thing, come up to the bicep tendon here, and this will help my female friends out there in the audience, because if you get menstrual cramps and you come to the cross of the elbow and then inside this bicep muscle, and you come up the inside of this bicep muscle, won't be painful while you don't have the cramps, but if you're having the pain of the cramps, the point will be amazingly painful. And if you have an acupuncture needle and a license to do acupuncture, an acupuncture needle put in that point will usually get rid of the cramps almost instantly, and they'll be gone for the rest of that cycle. But if you can't needle yourself, pressing the painful area and putting the laser pointer on there for about 3 minutes can release that as well. So it's all about mapping what area connects to what area. So if someone has a headache in the back of their head, it's down here. You know, this one that everybody talks about, it's more of a front head, forehead headache. These kind of things. It's about knowing what point corresponds to which area.
Interesting. I love that you bring that up too, because that's something that I've had personal experience with, is that you were able to give me acupressure points for me to use when I was out of town. I went to a pageant this past year, and while I was there, I was feeling short of breath, and so I messaged you and I said, I need some help, and you gave me an acupressure point, and you said, find the point where it's tender. And so I did, and then I would massage it. And while massaging that point, I would feel as if my lungs just completely opened up. And so it was fantastic because anytime before I went on stage, I would just press that acupuncture point to help myself out. But now I gotta try the laser though, because I had no idea that could have the same effect. That is so cool. Because we've also done
Glad to work for you.
Yeah, we've also done light therapy on my ear before for things like mood and like some brain fog, sensory processing issues, and all of those have always worked so well that I think out of everything that we've done before, light therapy has been the one that's been like, wow, that is so interesting that using light can influence in the same way as acupuncture does how our body communicates and it handles all of these different symptoms.
Light therapy is an interesting one because there's so many systems of light therapy. Because light carries multiple types of information. So color is one type of information, frequency and pulsation is one type of information. So there's numerous systems out there. There's color therapy, there's all these. The light therapy I favor is probably because I'm an engineer and I like scientifically proven and complex things. But one of my mentors is a gentleman named Raphael Nogier. And his father is the inventor of auricular therapy. And during his research, he found that there are 7 zones on the ear. Later, they found, his son Raphael found another one that was in front of the ear. But they correspond to these different cranial nerves that actually either directly connect to the ear or through other nervous connections interface with the ear. And that different pulsations of light at different measurable frequencies can trigger these nerves to cause changes in your pulse. And so the different frequencies that are mainly used are A through G. They also later added in the one that Raphael discovered, which was L. So A frequency has to do with your sensory organs, how you're perceiving things through your sensory organs, and how your tissues are staying hooked together, like tissue cohesion. So if you fell off your bike and skinned your knee and had a big road rash on your leg, you would have a problem with A frequency.
Okay.
So the body's very interesting, and the things I'm about to say are going to sound hard to believe, but I assure you I have researched and studied them and verified them firsthand, and they're true. So your body absorbs light from your environment, and it helps the body learn information about its environment, and your body also shines light out of your skin. You emit light. They've made chambers in Germany that have very sensitive photoreceptive liners, and you can put a human being inside the chamber and measure the amount of light coming off of them and in what spectrums it's in and things like this.
Interesting.
The weird thing is your ears only tend to put light off. They constantly receive. So if you're a woman with long hair and you constantly keep your ears covered, you can actually find by not getting enough light to your ears, you can start to feel depressed. Like if you cover your ears all the time and aren't getting any light to them, you can affect your mood in a negative way.
Interesting.
And actually, people with sensory processing and things like this who wear earmuffs all the time, if they don't let some light get into them, that could cause that problem as well. So you only put light off of your ears if you have a health problem. And you can use these little Kodak photo filters in the exact color spectrums of the light that comes off to read these frequencies. So you can put your finger on the person's pulse and you can move this photo filter towards the ear. And if you can bring it the whole way up to the ear without the pulse ever changing, that means they don't have a problem with that frequency. But if you bring it towards the ear and say within a small distance from the ear, the heart starts beating harder. And actually, it's not that the heart's beating harder, it's that the peripheral artery stiffens. And the reason the peripheral artery stiffens, or the blood vessel gets harder, so you feel the pulse more, is because the brain is sending signals out.
Okay.
That's a passive thing. That's like me talking. I don't really have to think, about what I'm saying because these are topics I'm familiar with. Mm-hmm. Now, if you ask me a question and I'm listening, my brain has to really pay attention. So when I'm paying attention, my peripheral arteries stiffen a split second and you can feel the change in pulse. So as you bring this reflector close to the ear, there's going to be a certain distance where the amount of light coming off the ear bounces off the reflector back to the ear, and it changes from being an output signal to now it's an input signal. Once it's an input signal, my brain has to process that signal, and now my pulse stiffens. So you can have a stack of these frequencies and go through and you can screen them and see what's wrong in the body. So we did A frequency already. B frequency, they're more complex than I'm making them out to be, but I'm going to give you the simplified version.
Okay.
B frequency is digestive system and allergies.
Okay.
C frequency is muscle tone, so muscles being too tight or muscles being too loose.
Okay.
D frequency is harmony between the two halves of the brain. And so if the corpus callosum that connects the two halves of the brain has stray electrical currents and things in there, it can affect things like your balance. It can affect things like learning disabilities, things like this.
I can see that being very helpful for people with neurodevelopmental disabilities like autism and ADHD, where the two halves don't.
I'm trying to do my best to treat some of those people. I've seen some pretty compelling results, but I've seen other cases that I haven't got the result I was looking for. So I'm still learning on how to fine tune it exactly to the individual. But one gentleman, I was treating the grandfather, and he had foot pain, very easy, case, and I was working on him, and I was telling him about it. He's like, oh, my grandson lives with me, and he has ADHD, and he's been having a real hard time in school, and he was failing all his courses. And so he's like, well, let me tell him about it. I'll see if he's interested. And when he found out there was no needles, I was just using light, he's like, sure, I'll try it. In one treatment, he went from failing all his classes to having a B average.
Okay, so it can be very effective.
It can be really effective, but at the same time, I've had other people who I tried to treat, and we did not get that grandiose change. I've had good success with bipolar disorder. I've had some good success with MS. A few things like this, the light therapy can be really powerful. Now, the weird thing about light therapy is, unlike acupuncture, where you notice it right away or the next day, sometimes it can take up to 10 or 12 days before the result kicks in. So there's a little bit of a time delay, but the interesting thing is the results seem to be much more long-lasting.
Oh, yes. I can speak from experience on that one, that anytime we've done light therapy, I won't typically feel it for a couple days, but then once I do, those next couple weeks, I'll feel fantastic. And so then I only have to get that done every 3 weeks or so, and I'll be feeling good during that period, which is pretty impressive. Whereas acupuncture, I know for me, I need that weekly treatment for my body. So very interesting.
Gotcha.
So what are the other ones
And
then?
so we stopped at D, so that was harmonizing the two halves of the brain.
Okay.
E has to do with pain, your spinal cord, and skin conditions.
Okay.
Frequently I'll see E show up in cases of psoriasis or eczema and things like that. And that one actually can be fascinating because there's a signature system in the body where if the person has a skin condition and you shine the pulsating light on that patch of eczema, for instance, and you're monitoring the pulse, and you go through all the different frequencies, and say it brings up 3 frequencies, say it shows up A, B, E.
Okay.
And then that point was on the elbow, so I come to the same side ear, and I go to the elbow area, and I use the reducer nozzle to make a tiny point of light, and I move it around until I find the spot that changes the pulse with the exact same frequencies.
Okay.
Then I can treat that point, and frequently I have fantastic results getting rid of eczema.
Wow,
So
interesting.
sometimes it'll fix it in as few as a few days, but I can't guarantee all the time, but frequently very successful at treating skin conditions.
Okay.
So that was E. F is lower brain functions. Think of like running your survival functions of your body, your organ functions, and hormones. So if people are having hormone out of regulation, we would use an F frequency. F frequency is also this really pretty purple color if you go by the color. And shining F frequency on the third eye, really, really relaxing. So people with high anxiety, high stress, it takes that fight or flight response and kind of helps down-regulate that.
Interesting.
So it's a nice parasympathetic calm down for the body. And then the last one is G frequency, and G frequency is more your higher emotional functions of the brain, but also disorders that come from long-term emotional patterns. So if you have what they call a psychosomatic condition, where you've dealt with a long-term emotional state and now it's manifesting physically in the body, that'll usually throw G frequency. And then my mentor discovered the L frequency, which is not on the ear, it's slightly forward. And L frequency has to do with more specific for learning disabilities. So D frequency is going to be much more your balance and gait problems. L frequency is going to be fine-tuning right in on your learning disability type things.
Okay, very interesting. All right, I have 2 more questions for you here.
Sure.
One of them is for those who may be skeptical about all of these different treatments that you just mentioned. What would you tell them? Is there a way that you would encourage them to try something that they're skeptical about, just to see if that's a good fit for them?
First and foremost, I commend you for being at least somewhat skeptical. It's easy. There's a lot of people out there promising the world. And so be rational, be scientific, think things through, audit what you hear, see if you believe in it, kind of thing. And then see if there's measurable results. My thing with treatment is you should see change. Some things take a couple treatments. I'm not going to say that it's one shot every single time, but frequently, if you come to me with a symptom, I'm looking to see a change. If not by the time you get off the table, then by the next day. Unless it's light therapy, and then I tell you in advance, this has a time delay to, when it's going to work. But most of the time, the proof is in the pudding. Like if you go to a practitioner and they're getting you results, then even though they shined a weird flashing light on your ear and you feel like you're on Starship Enterprise, if it works, it works. And so these are all based on, really scientific, background research that were conducted by Western medical doctors in Europe. These things were audited in, Italy and France and modern countries. And then here's the thing I like to say about human nature is human beings are not stupid. If there's a medical system out there that never works, it's complete hooey, no one would be doing it. Who would choose to do that for a career? No one wants to just defraud people for money, or good people don't want to defraud people for money. And so if these things are working, if people are claiming, if there's a following, if acupuncture's been licensed by our government for something that works, that means there's research to back it up. And there's plenty of research. Now, when it comes to acupuncture research, we hit some stumbling blocks because research is designed by Western medicine, and the standards that you would audit proper Western medicine by, in my opinion, should be slightly different than how you would audit Chinese medicine. And the reason for that is a saying in Chinese medicine that is, many diseases, one cause, or one disease, many causes. So an example of many diseases, one cause would be, say somebody's liver energy is blocked. And as an engineer, I don't like throwing around just the term energy, it's kind of vague. So what I mean is, say the physiological outcome of your liver system in your body, which is both, how it affects your muscles and tendons, how it affects your vision, how it affects the function of your actual liver, how it affects your digestion, all these things. If these are off, a high-stress lifestyle pattern can cause many different things. You can start having floaters in your vision. You can start having more clotting in your menstrual cycle. You can start having breast tenderness or tightness in your flanks. You can start having irritability. All these things are your liver is kind of blocked up and not working the way it should. So that's one pattern causing many manifestations. Or you take something example of a headache. Many causes, one disease. So there are at least 6 different types of headaches in Chinese medicine. So if you're having a forehead headache, that's one type of headache. If you're having, temple or behind the eyes, these are all different types of headaches. But headaches can also be caused by muscular tension. Headaches can also be caused by hormonal imbalances. Headaches can also be caused by allergic responses. So if you set up a study to see how well acupuncture works for headache, and you bring in 1,000 participants, but they all have different types of headaches, but you tell the acupuncturist you have to use the same 3 needles. But those needles are chosen based on what type of headache they have. You're only going to be successful at treating the people that have the pattern that walked in the door. So we don't have a separate type of research where you can choose different needle patterns for whichever type of headache walks in the door. So it's going to affect how it gets tested in the research. I'm all for scientific research. It's the only way that we grow and evolve. People love acupuncture and they like to throw around the whole concept of, it's thousands of years old. And yes, if you trace it back to its very origins, they've been doing something related to it for thousands of years. But the acupuncture I do today evolves every single year. And so the things that I do are definitely new. All the auricular medicine started in 1959 and moved forward from there. This is modern science. We're using science to take an old system and make it better. And so it's the kind of thing that we need good research, but at the same time you need to understand how a system works to build research that can fairly measure its effect.
That's a perfect explanation. That's perfect. I don't know how to say it even better. I the way that you just described that, I never knew that, and that makes a lot of sense. All right. Is there anything else you'd like to say to those who are struggling with chronic conditions, who may be struggling to hold on to hope that they will find a treatment that will help them feel better?
My thing is, like I said, I'm an engineer, and I've been beating that to death, but there's always new information out there. People are always learning. There may be well-established systems just you haven't learned about yet. Do your due diligence. Do your digging. Find out if they've given you a diagnosis, what actually is happening in your diagnosis. Get to know your own body and your own conditions, and then start looking at other systems that can affect the messengers that control those systems or the systems themselves. Audit them. Try a few. If you're suffering, it's not, I'm not saying go out and spend thousands and thousands of dollars on the newest weird electrical gizmo that's supposed to just magically fix that, kind of thing. But see what you can find that's out there, because literally my reason I love this job so much is I get the people who have tried everything else. And the idea of sticking a teeny thin shaft of wire into your skin is going to change my whole endocrine system. That seems ridiculous. But your body is a miracle, and it has many subtle signals within it. For instance, like we were talking about light therapy, we were talking about all these other signals. When you have an infection and a white blood cell travels to the site of the infection and it eats its fill and then dies. When it dies, it puts off a burst of light, and that light signals the surrounding tissues to heal, and it summons more white blood cells. Like, these are documented facts that people have gotten Nobel Prizes and things for. It just hasn't worked its way out into common knowledge yet. And there's so much out there that you can study and that you can learn and that you can try. And so I get people that come in thinking that they're going to live in pain forever, or that they're going to be suffering forever. And no, I don't fix every single one of them. I really wish I could, and it's why I study every single day. Because as long as there's been one person I can't fix, there's more homework for me to do. But I fix a lot of them. I would say when I started my practice, my success rate was about 70%. And since I don't charge you if you don't get better, I don't feel, that's me wasting 30% of my time. So I kept studying. And when I learned Taiwanese acupuncture, I jumped from, say, 70% to maybe 80%. And then I started learning all the auricular medicine, and I started finding about blockages in the nervous system and why the signals I'm trying to send to your nervous system may not be reaching where I want them to go. And then when I started learning how to identify these blockages and remove those, I'm getting close to 90%. So I'm not perfect, I'm still working on it, but I'm pretty happy with how much I've grown over the years. So.
I find it amazing because we were just talking about how I feel like every time I come in here, I learn something new from you. I mean, you would just have so much knowledge that you've built up over the years, yet you continue to tell me that you learn new things every single day, which is, I think, offers me a lot of hope too, because if somebody like yourself, who has treated so many people and has seen so many people improve through all of these natural remedies, and you're continuing to learn even more every single day, that means that there's so many opportunities out there for people to find healing in this way. And so, thank you. I think that's a great note to end on. I want to thank you so much for spending this time with me today, especially through the technical issues that we've had. If you want to learn more about Darren, you can visit his website at mracupuncture.com. And for more health-related content like this video, you can follow me on Instagram at finding.your.internal.symphony. I hope you've learned something new today. I know I have. Thank you so much for watching, and thank you so much for tuning in.
Thanks for listening.